Hello, and thank you for tuning in. I'm your host, Neal Howard, here on Health Professional Radio. Our guest today is a certified plastic surgeon, and he's here today to talk with us about some of the latest in breast reconstruction and reducing the risk of surgical site infections. We're going to talk about that today with Dr. Alan Gabriel. Thanks for coming today.
Thank you for having me, Neal.
Glad that you could come. Now, reducing the risk of surgical site infections and the latest in breast reconstruction, is there a higher risk of some site infections when breast surgery is involved?
Well, Neal, first of all, I want to say this is probably one of the most exciting times in breast surgery that we've seen with all the advances that have come forward. And those advances not only include the implant technologies, but also the dermal matrices technologies. And lastly is the protection of these devices that we use for breast reconstruction or any other surgical types of incisions that we manage. The risks are, of course, of any type of surgical site infection or problems with the wound are existence in all types of surgeries that we do, but they're definitely at a higher risk in patients that have higher BMIs, diabetes, prior history of radiation, uncontrolled diabetes, and as well as immunosuppression that is present. When we're looking at a specific incision that's at risk for surgical complication, really in my mind it falls into two categories. One category would be if that type of incision or wound is at a high risk for seroma formation. And what would that be? Those are the types of wounds that were large undermining, meaning we're going under the tissue, and there's a lot of dead space that's present within the fascia and the skin that we're closing. High BMI patients automatically fall within that category. And if we're using any type of biologics and synthetics, all these lead to higher seroma formations. Then there's the other factor that the incisions are at high risk for surgical complications. That is the dehiscence. So that's the second portion of it. So when we're thinking of dehiscence, who's really at high risk for breaking their wounds open after we have operated on them? One would be a tight closure. We force it closed, even though maybe some tissue was lost from trauma and there's not enough there. Or maybe some tissue was compromised from a traumatic injury and we're trying to close it and there's not enough good blood supply in there. Repeated incisions through the same scar, the more we go through the same scar and we don't actually excise it and remove it, and we weaken that scar over time. And then lastly, all the risk factors I already mentioned, the diabetics, high BMIs, smokers, history of radiation, immunosuppressed patients, as well as soiling. Soiling is an interesting factor that we should also be considering, especially when abdominal type of procedures are performed or colostomies are brought out. Usually we try to get the incision covered before a colostomy, for example, is matured.
So are we seeing the same infection, or are there different types of infection based on, as you say, the different types of incisions?
Absolutely, Neal. So there's definitely infections relate to the type of procedure that's being performed, and there will be different bacteria that will be involved. But the best way we can do this is protect these incisions, and that is when I've used what I just discussed in terms of these wounds that are high risk to protect these incisions, basically kind of protect our investment with the incisional management device, which is the Praveena in this case. Especially in breast reconstruction, it's really important because there's a lot of products that are being placed. You have dermal matrices, implants, and now we're closing over these devices and letting the body heal. But we want to protect that investment. That's a large investment we've done, and no better way than protecting it and keeping it sterile for 7 days with this particular device that I use.
The World Health Organization, I do believe, has recently updated some of their guidelines as they relate to infections. Can you talk about some of these updated guidelines?
Absolutely. So it's very exciting to see that the World Health Organization actually has announced their new global guidelines concerning these surgical site infections. And it's really, I think the reason this has happened is because it's a significant contributor to unnecessary costs that are associated with these patients' complications. And some of these costs can be in hundreds of thousands of dollars. But really, what ends up happening is they've actually announced that the World Healthcare Organization agency has suggested that use of negative pressure incisional management device, which is the Praveena, should be used as a prophylactic way over conventional wound dressings on primarily closed surgical incisions in high-risk wounds for the prevention of surgical site infections. So it is because the evidence exists, and we're seeing good, excellent results with the device that we're using in these high-risk patients. And again, the high-risk patients fall exactly in the category that we just discussed. And should this be used on every patient? Well, no, we should be thinking about who we should use it on, who's high risk for breakdown of the wound.
Now, although the World Health Organization has updated their recommendations on the Praveena device, where, to your knowledge, is this device available? Is it available just only here in the United States or maybe in Britain, Australia? Do you know if it's a worldwide availability as of now?
I believe, Neal, it's a worldwide availability as of now, and it's exciting because it's a product that definitely has changed my practice, has changed the way I manage these surgical types of incisions, and should be available. And I think one of the company is Acelity, so it would be found on acelity.com. Where the additional information would be, and who depending on the country, who the distributor may be.
How easy is it to learn to use this device after having been dealing with incisions in the traditional way?
It's probably one of the easiest things that you can do. So traditionally, what have we put? I mean, whatever dressing was available to us at the facility. So either it was just a piece of gauze, or we taped it, steri strips. But if you really think about it, none of these are really sterile. We're just putting them directly over an incision, and we're just putting gauze, and we're sending the patient out. This is very simple. It's in a package. You take it off the shelf. If you all of a sudden decide, oh my God, this incision looks extremely tight, and I'm worried this is going to fall apart. Well, no better way of protecting it and improving the healing process by adding negative pressure and keeping it sterile. So you get it off the shelf. Take it, put it back on. Everything is there, off the shelf. It's connected to an iPod size. I guess iPods are no longer available. Well, I guess it would be an iPhone. What would it be? 6 size machine that it's connected to. And then that's it's a very small size, and they can shower with it. My patients shower the next day with it, so it's extremely simple, and patients are comfortable with it. And as a surgeon, when these patients are going home, and sometimes we don't see them for 2-3 days, I can comfortably say that the incision I closed has remained sterile until I remove that dressing 7 days from the time I placed it, because it was placed sterilely in the operating room.
Now, in wrapping up, Doctor, you mentioned a website just a few moments ago in our conversation. Could you mention that website again, and is that the same website where we can get much more information about Praveena?
Absolutely. It's Acelity, ACELITY.com, and you can find enough information about Praveena and surgical site infections. If you go on Acelity.com and click on the Praveena Incisional Management System, you'll find out more information. The newest Praveena has actually, you can treat 2 wounds at the same time, is the Praveena Duo, which I use for breast reconstruction because it's extremely simple to use. The patient is connected only to one machine. So it's really nice, and the advances in managing our incisions has definitely changed over the last few years, and it's really exciting where we're headed.
Well, some great information. I'm glad you could take some of your time and speak with us today. Dr. Alan Gabriel, thank you so much for coming.
Thank you, Neal, for having me.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download on SoundCloud.